And so contingency management really can change the culture of corrections, where instead of a focus on catching people doing bad things, you're really incentivizing people to do good things.
Welcome to Dopamine Dialogues, the show where we meet experts working with contingency management, translating the science into what actually succeeds in clinics, communities, and day to day operations with patients, clients, and beneficiaries. So, whether you're a provider, payer, policymaker, or just CM curious, you're in the right place. I'm your host, Larry Klimchuk. It is with great pleasure I get to welcome our next guest, Dr. Faye Taxman. Faye Taxman, PhD, is a university professor at George Mason University. She's a health services criminologist. She is recognized for her work in the Department of Seamless Systems of Care models that link the criminal justice system with other healthcare and service delivery systems. This has led to re-engineering probation and parole supervision services. Faye, it is great to have you join us here on Dopamine Dialogues.
Great to be here, Larry. Thanks for inviting me.
Oh, our pleasure, our pleasure. Well, Faye, maybe could you just start off by telling us a little bit more about your roles and responsibilities, and maybe more importantly, how you came to be interested in health services in the criminal justice system?
So I'm trained as a criminologist, which means that we look at the problem of crime from many different disciplines and angles. And I specifically was interested in this question about what role does the criminal justice system and all of its different components, what role do they have in helping people improve the quality of life and also deal with some of the behavioral health and health issues that affect people's involvement in criminal behavior. So early on, I was an evaluator. I looked at programs and services. And throughout my career, I've done a lot of different components, from designing interventions to working with organizations to try and implement the evidence-based practices or evidence-based treatments like contingency management within those settings. And so, my interest area is that, we have a system where almost 10 million people currently come in contact with the criminal legal system. It's actually more than that. If you look at all of the different police interactions, it's more like 320 million people. My questions have always been, how do we improve the delivery of justice so it's affecting how people behave in our society? And traditional criminologists focus on recidivism. I'm trying to focus on aspects related to improving people's quality of life, and that includes their health conditions. So, and my interest started, to be honest with you, I had a sibling with a substance use problem who came in contact with the juvenile justice system, and it only made her condition worse. I mean, she was exposed to other people with substance use issues. The people who were selling drugs would constantly hang out in the area where the people with treatment programs were. And, it seemed to me that that was not the right sizing that we should do in terms of how we help people with various types of issues that come into the criminal legal system. So, from a very, in my doctoral studies, I had this personal interest and it has carried through. Um, and particularly now, where we realize that the largest concentration of people with mental health issues and with substance use issues are in the criminal legal system. And therefore, in my perspective, those systems should really help people improve the quality of their life.
Thank you very much for that, Faye. I mean, that's very kind of you to share your own personal experience and commitment and how you became interested in this. And I love the way you said, the first thing that you said was, I'm all about improving quality of life. And if you're improving quality of life for millions and millions of people, directly and then indirectly, that is such an impact. You mentioned evidence base, and your publications include implementing evidence-based community corrections and addiction treatment, plus health and justice. Can you share with our audience some of the key messages in these publications that they like to pursue those more?
The issue is that we have an accumulation of knowledge through science about, how do we help people either improve themselves or facilitate improvement in people's behavioral health or physical health. And so the evidence-based practices or evidence-informed practices literature basically helps us to look at this issue about what should organizations be doing? How do you set up services in such a way that you can really make improvements? One simple area, which is not so simple to do, but that simple area is making sure you're screening and assessing people for what kind of physical or mental health conditions they have. Well, screening tools are difficult when you have people involved in the criminal legal system who don't really have the skill sets to implement tools. And so, it raises a whole number of other issues, which is how to teach staff to interview people, how to deal with confidential information, how to motivate people to help them change. And so my literature has basically looked at the not only what should we do in terms of what programs and services, but how. What are the staffing leadership issues that are really important to be able to move ahead? And I have a couple books out on this particular subject, one on implementing evidence based treatments in criminal justice and community corrections and addiction treatment with my dear colleague Steve Belenko. That book is actually about 12 years old now, but we have a number of other publications. And I've moved towards really focusing attention on what's now called implementation science, which is the answer to how should we do this? Because we have learned over the course of our past 60 years that we implement, but we don't implement with enough oomph to actually have the fidelity to make something work well. And so that's, to me, is what our goal should be.
Very, very, very well put, Faye. I love the way you started off with the kind of the what in that screening and assessment side of it, and that has to be done properly just to start off, right?
Right, right.
And then there has to be the leadership and training to ensure that the how is going to work. And this area of implementation science, I think, wraps all of that up from what needs to happen in that initial period of understanding, and then ensuring that people are properly qualified and implementing to a high degree of fidelity and professionalism. So thank you very much for that. You're obviously a very well-known expert in correctional excellence. Could you share your thoughts how contingency management makes a difference in this area?
Well, as you can imagine, the criminal legal system is mostly about punishment. In other words, our society has taken punishment as a way in which you change or help people change their behavior. But essentially, punishment does not work. And particularly for people who are consistently exposed to punishment. So, incentivizing key behaviors and being clear about what you want people to do is a way of really helping people to learn new traits and new ways of handling life situations, which we know are very complex. People experience a lot of disappointments. Things don't work as well. You have a heavy burden because you're taking care of other people. And so by incentivizing people, the justice system is basically showing people this is the behavior that's desirable. Right? And we're showing people that if you do these things, you can basically succeed. And by reinforcing with some sort of contingencies helps to make that point even better. So here our situation is that in the criminal legal system, we can incentivize. And so things like helping people understand that if you do drugs, if you happen to have a drug related problem, that you can actually change your behavior by not using drugs. And then the system, reinforces how important that is by rewarding you. And so contingency management really can change the culture of corrections, where instead of a focus on sort of, doing people or catching people doing bad things, you're really incentivizing people to do good things.
What makes contingency management successful in the real world? Are there some lessons learned there that you've experienced that, make sure that you're getting the results that you want to get?
So, we've done several studies to implement contingency management in probation settings. And the things we've learned are one, helps the staff to have a better interaction with a person, right? If you're always connecting with people and telling people you're doing this wrong, you're doing this wrong, it really sets a negative environment, right? But with contingency management, staff can basically say, wow, that is really great. This is your third week in a row that you have tested negative, right? And so it really changes that dynamic with people, one. Two, it gives staff a different role that they're playing here. They're cheerleaders, they're champions of people instead of basically being the sanctioner, the punisher. The other area is that the staff and the client are working on very tangible behaviors. And so things are not like be a good citizen. It's like, okay, this week, you're going to essentially continue to not use drugs. And therefore, people get rewarded for that. And I think one of the last things is from the client lens, the client doesn't feel like the justice system is out to get them. I mean, unfortunately, with the punishment system, which has overextended the use of incarceration, the going statement is we're trying to tail them, nail them, and jail them. Well, contingency management changes that around so that people realize you're trying to tail them, but you're not trying to nail them. You're really trying to encourage positive behaviors. And so that's the advantage that this brings.
Faye, I love the way you said that, and the it's interesting because so many people talk about contingency management for the benefit for the patient or parolee or whoever it might end up being, but you actually started with the staff or the clinicians
Right.
because, and it almost comes back to your earlier comment of assessing what is needed and then really focusing on how to do it. And what I hear you saying is contingency management is a great process and tool to build up your staff and build up your clinicians' confidence level, their skill level. And then they're presenting themselves in a whole new way and they're getting job satisfaction, which translates then into the interaction, obviously, with the patient.
Right.
Another key item that you nailed was the tangible measurements. This isn't a feel good sort of thing. Yes, at the end of the day, when you do the right behavior, it feels great, but you're measuring something extremely tangible and you're getting that desired behavior. And then, of course, you wrapped it up with, well, there is benefits to the patients here too, and now they're changing their lives in this new process.
Well,
Um, oh, go
that
ahead.
that lens that I bring comes from a focus on quality implementation. And quality implementation needs to start with the environment and the culture of the organizations. And unfortunately, both the punishment system, but a lot of substance use treatment and mental health systems are very negative in terms of their attitudes towards the clients, mainly because these behaviors are difficult behaviors. And so people get jaded and they basically position themselves as sort of monitoring and oversight. And all that does is basically lead people down a pathway. So that's why I like to start with the whole organization. What are we trying to achieve here? Well, with contingency management, we're able to achieve the greater goal of changing the environment to facilitate change on clients.
Fantastic, fantastic. Faye, could you just touch on your experience or any recommendations that you have for the audience about outcome measurements, reporting, ROI considerations, things like that for the payers and or the policymakers that are out there? I mean, a moment ago you said, what is your objective? But then what are some of the outcome measurements that you like to have people focus on?
Well, first of all, if we're looking at changing the culture, then we have to measure at the staff level, counselors, probation officers, case managers. We need to measure from them whether or not they accept that this is a legitimate role for themselves and whether or not they accept that they are facilitators of change as compared to kind of positioning themselves as demanding change. So, one set of measures have to be at the staff level about their acceptability and what they think is feasible. Another set of measures from the client perspective is how long will people remain in the state that we're trying to encourage them? So, if we're encouraging people to not use substances, illicit substances or alcohol, then the question is how long can a person retain that sort of condition? And that's one measure. Another measure is whether or not the person feels like are accomplishing something. I mean, so often individuals who are in treatment environments, you almost feel like they're going through the motions, but they haven't really embedded it. So we want information from the clients themselves about how their lives have changed, how their perceptions of their own hope for the future has changed. And then in the criminal justice system, we always have to add the question about recidivism. Has the person's behavior changed so they are not being arrested and they're not being incarcerated?
Thank you. Thank you. And again, I love the way you always bring in the staff side of it and the patient side or the client side of it. Faye, from your point of view, what misconceptions are still out there about contingency management?
I think the major misconception is the saying we're paying people to do things that they should already know to do. The second misconception is that the contingency is not a therapy or not a behavioral therapy. So on the first one account, we're paying people. The reality is that we're not paying people to do things they already know. We're actually incentivizing people to engage in a set of behaviors that they're unsure that they can actually accomplish, right?
Right.
So you have someone has started using self-medicating when they were 10, 11, 12 years old. They're now 25 years old. You can't say that they know what they should or shouldn't be doing. What you actually need to be thinking about is how do you help that person realize that there are other options in life? So that is to me critically important. And then you raise the return on investment issue and seeing people transform their life in a way in which they're becoming more productive citizens. they can take care of themselves, they can take care of their families, is one return that we don't often measure. Like most people don't do what's called cost benefit analysis. So we don't look at the benefits. We just look at, oh, we're going to spend this much money to do this. But I think in this situation, we really should be doing much more cost benefit analysis. I mean, for example, California, um, Q2I has worked with the state of California to implement contingency management for stimulant users. And that work has basically shown that it is feasible for substance use agencies to do this. It does take effort to get counselors to agree that they should have that role. But then the benefits from the clients are just enormous in terms of people, one, not abusing stimulants, but two, getting employment, having more stable housing. All of those are benefits that really reduce the cost to society and they make people feel that they have a role in society. So I think, our challenge with contingency management is that the American culture primarily is one that people pull themselves up by their own bootstrap. And we don't sort of think about the fact that, change is a difficult endeavor and people need help to achieve that change.
Well, yeah, change is not easy. It
Yeah.
definitely isn't. And, having people around you giving you encouragement or incentivizing you for that positive behavior is massive. You opened up this conversation, Faye, which I have thoroughly enjoyed about changing quality of life. And in your last statement, you kind of almost came right back to that of changing the quality of life of the patient or the client and everybody around them as well. It really is. It does have an overall benefit for society.
You know, the thing is that when one person makes a change, it has a domino effect because the people that they love are also being exposed to this change. And it can encourage other people to be able to address some of the things because sometimes some of our problems, we're human beings. They seem like we can't deal with them. But contingency management is a way of sort of helping people realize take that small step and that small step can lead to other steps. And I think that to me is one of the other kind of advantages of this type of behavioral therapy.
Thank you for that. Um, I only have one last question, and that question is there a question you'd like me to ask of you?
I think the only question I would ask you to ask me or that I can answer is basically, should contingency management be mandated
Mm,
as part of the American healthcare system? And the reason I say that is because, I mean, in the US, we have a very complicated healthcare system, and most of the healthcare system is basically self driven, where people, you know, have to recognize they have an issue, then they have to find someone to help them deal with that issue, and then they have to move forward in trying to get care. There's nothing built in there to really encourage positive behaviors or prevention, which is unlike some of the Europeans' healthcare systems where prevention is prioritized. So obviously, I've given the answer to my own question, which is yes, it should be mandated. Yes, doctors, nurses, social workers should be compensated for preventing certain behaviors and incentivizing the types of things that will help all of us take better care of ourselves and have a better quality of life. So it's a little outside the criminal legal system, but it's really about our society at large has not really kind of taken to heart that, there is a way in which we can encourage positive behaviors. I mean, people talk about this, be kind, right? But there's no reinforcement structure for be kind. So I'm just suggesting that CM may be that tool.
Wow. Well, thank you very much for that. Interesting, talking with some other people in and around the industry, they say when we're kids, our parents, our teachers are incentivizing us to do the right behavior, right? They put up charts or you get this award or you whatever it end up might being. But essentially it's an incentive-based system for doing a desired behavior. And for some reason that stops when we become adults.
Well, it actually stops more so when you're in high school, right? Around 15 or 16, because we have this sort of notion that by the time you're 15 years old, people know how to behave or what they should be doing. And I'm not really sure that's true, but
We can certainly improve. There's no question about it.
definitely.
Uh, Hey, this has been absolutely brilliant. Thank you very much for your insight and sharing with us some of your personal experiences, but your professional experiences as well. And I have, like I said, I've learned a lot in this podcast, and we would like to very much thank you for joining us here at Dopamine Dialogues.
Not a problem. And thank you for inviting me, Larry.